Live from the French Quarter, this is Eyewitness Morning News.
Louisiana is the 12th in the nation for its rate of suicide, and St. Tammany Parish has one of the highest suicide rates in the state. There are special programs offering help to prevent these deaths, and this morning for Suicide Prevention Month, Rebecca Thies with the Volunteers of America's Crisis Response Program is here to talk about these programs. And Rebecca, thank you so much for coming in to talk about this important issue.
Thank you for having me.
Well, first of all, tell us about the Crisis Response Program. What do you offer?
Well, the Volunteers of America Crisis Response Program was formed in 2011 at the request of St. Tammany Parish government officials. The officials wanted to address the high number of suicides and the rising number of behavioral health crises in the parish. And so we put together a program that has really two components. One is the crisis response piece, and we have someone on call 24 hours a day, 7 days a week, a mental health professional who will deploy to the scene after a 911 call. So if officers get a 911 call about a behavioral health crisis and think that we are needed, they will call us and we will do whatever they need us to do, whether it's provide support on the scene or if there's a medical emergency, go to the hospital and provide support there. After the crisis has subsided, the unique part of this program is the second component, and that's the aftercare component. What we do is provide case management services basically for families. It's unique in that all the research shows that if a person receives help following a crisis, he or she is less likely to experience another crisis. So we really provide any kind of support and guidance, education. Sometimes it's basic needs like, food and shelter, and sometimes we provide emotional support and education for the families.
And what are the warning signs that people should look for in family members or should recognize in themselves that they have a problem?
Well, there are a lot of things to be aware of. One is an increase in depression or feeling hopeless. Sometimes I view it as looking for changes in behavior. If someone is experiencing more self-destructive behavior, using alcohol or drugs more, if someone talks about suicide or wanting to die or ways to die.
Don't take those signs for granted. Sometimes people will hear that, and especially friends will hear that.
Absolutely.
And they think that it's nothing.
Right. And I think that's the key, to be very observant. To know your family members, to know, and to ask questions. So many times we operate in a silo and we're afraid to ask. But, ask someone, are you feeling suicidal? How, what's going on with you today? That sort of thing. And to seek help, to ask professionals for help. If you don't know the answer, to get guidance from someone who might.
And what do you think is the cause for suicide? I know that's a very complex issue, but that hopelessness, how do you counteract that sense of hopelessness?
It's very difficult to pinpoint. There are a lot of people who it could be a mental health crisis, but not everyone with a mental health disorder is suicidal, and certainly not everyone who has been suicidal has a mental health disorder. Sometimes it's just the inability to cope and not knowing where to turn for help. Trauma after trauma compounded on one another really has played a big part of it.
And what number can people call if they just need someone to talk to?
I think the best number to call in this area is 211. It is an information and referral line. However, there are people on staff who are trained crisis intervention professionals, so they can guide anyone who calls toward to the best place for help.
Rebecca Thies, thank you so much for being here.
Having me.
And on this subject, if you want to find out more about the help that the Volunteers of America offers in terms of suicide prevention, you can call this number. It's 985-674-0488. Other numbers to call are the National Suicide Prevention Lifeline. That's 1-800-273-TALK. 1-800-273-8225. And via link, just dial 211, as Rebecca said. That crisis line connects callers to information about health and human services in their specific area. Also, there's a walkathon for suicide prevention or suicide awareness going on this Sunday in Slidell. The event will take place at the Living the Word International Church at 1000 Caruso Boulevard in Slidell. That event starts at 4 o'clock Sunday afternoon.